I'm Dr. Karen Harum, neurodevelopmental pediatrician, and thanks for tuning in to the Vibrant Children channel. This series of blogs focuses on actual patients of mine, and it drives home the reality that developmental disorders are treatable and that the brain has an amazing potential for healing. Well, what is mitochondrial dysfunction, and what does it have to do with autism? You see, mitochondrial disease as a recognized disorder only entered the medical literature less than 30 years ago. So, in this relatively short period of time, the clinical description of mitochondrial disorders has really broadened, widened, and we now appreciate the more subtle presentations of mitochondrial dysfunction. Well, what are the mitochondria? They're tiny little cellular structures within each and every one of our cells. There are multiple mitochondria within each cell. And these tiny cellular structures are actually the powerhouses or the energy plants of our cell. They produce molecular energy to power up the cell's natural functions. So just like autism, not all mitochondrial disorders are genetic. Some develop over time and are caused by drug reactions and even environmental toxins. Please check the written portion of this blog because I'd like you to see that there are scientific references to all of the statements that I'm making. When one has a classic mitochondrial disorder, there's significant impairment in brain function. The more subtle manifestations may include seizures, regression of skills, developmental delay, migraine headaches, weakness, and even specific nerve impairments. Back in the fall, I presented a case of mitochondrial dysfunction when I was talking about the underlying causes of autism, and you can check back in that blog series and hear of another case. So today, I'm happy to report improvements in another 3-year-old boy, Ronnie, who has lately taken off with improvements in eye contact, language expression, language understanding, reduced anxiety, and also improved waking. This little guy presented over a year ago with the classic elevations in lactate, pyruvate, alanine, increased oxygen-free radicals, increased anion gap, intermittent increases in ammonia, and in liver enzymes on his laboratory evaluation. And keep in mind that most of the abnormalities that I just spilled off to you are abnormalities that can be detected in the routine laboratory assessment. Likewise, he presented with the classic features of mitochondrial dysfunction, which are developmental regression, low muscle tone, poor weight gain, intestinal dysfunction, and also difficulties with learning. To begin treatment, I really needed to support Ronnie's intestinal dysfunction by adding digestive enzymes and healthy bacteria to his gut. His diet became very complicated due to his need for lots of calories and his refusals to eat on top of that. So reducing belly pain and improving sleep were of top priority in helping this family. And just as with the previous case presented of mitochondrial dysfunction, we began to support Ronnie's mitochondria specifically with the vitamins and cofactors that the mitochondria use regularly to produce molecular energy. And these include coenzyme Q10, high levels of B vitamins, the medium-chain triglycerides or specific fats in the diet, specific antioxidants like vitamin C and vitamin E, and also carnitine. And dietary prescriptions played a big role in the treatment of Ronnie and other mitochondrial disorders. For example, if there's a problem within the mitochondria with fat metabolism, then fats are not going to be metabolized well for energy production. And so we need to feed the other molecular pathways of the mitochondria. If there are problems with glucose metabolism, then alternate energy can be supplied with dietary ketones. For example, the ketogenic diet. And very importantly, if there are other organ systems that are not powered up adequately to fulfill their specific functions, then those organ systems also need to be supported, like the thyroid gland and the immune system. They are often in need of various supportive treatments. In the fall, I laid out some very specific recommendations in the blog on mitochondrial dysfunction, and I invite you to check back on those specific supportive mechanisms, treatments, by logging on to www.vibrantchildren.com. Ronnie's parents have worked extremely hard to follow the recommendations that followed his extensive biochemical testing, and they have been successful. He's playing, exchanging information, singing beautiful songs, growing, and more importantly, he seems very happy to be himself. And that's our goal as parents, is to raise happy, healthy children.